Hi, everybody. I'm Dr. Soffer. I'm the integrative medicine physician here at Smilo, and I've been asked to give different talks about wellness. People often ask me what integrative medicine is, and I always say that really our goal is to find the least invasive thing possible. What is the biggest bang for our buck without causing harm or being invasive to our bodies and ourselves? So my other job is pediatric allergy and immunology. And so because of my interest in integrative medicine and my interest in allergy and immunology, I'm often asked, Dr. Soffer, how do I boost my immune system during this pandemic? And it's a reasonable question. And really, the most simple and easy answer is getting a good night's rest. And so if you're anything like me, you've really struggled with this since the pandemic started. First of all this news is probably making you overwhelmed and disturbing you and bothering you and keeping you up like it does with me. And our schedules have gotten completely thrown off. We're not waking up at the same time. We're not going to sleep at the same time. And so all of this has really impacted our biological clock and in turn probably impacts our immune system to a certain degree too. So what are the things that we can do to really give ourselves a good night rest? Well, the first thing I want you to keep in mind is that if you are having struggles with sleep, you're not alone. So 60 to 70 million people at baseline in this country suffer from insomnia. So you can only imagine what it's gotten to be now since the pandemic started. The biggest complaint I often hear is, Dr. Soffer, I wake up in the middle of the night. And I want to reassure you that that is completely normal. Okay. Everybody wakes up in the middle of the night. Some people notice it, some people don't notice it, but it is completely normal to wake up in the middle of the night. Just hearing that and acknowledging that often allows many of my patients to feel comfortable going back to sleep. Sometimes that's not enough, and we'll talk about different tools and techniques that you can use to getting yourself back to sleep. But the first thing I really want you to do is I want you to set aside 8 to 10 hours of your night to sleep. So no matter what time you decide to go to sleep at night, I want you to make it the same time every night. So whether that's 8 o'clock, 9 o'clock, or even 11 o'clock, I just want it to be the same time. And I want you to sleep for the same length every night. The reason is that our biological clocks work as a clock. And so if we throw off the timing, we're going to throw off that. And our immune system does rely on a biological clock to be functioning. You know, we've seen immune issues with shift workers, people who work overnights and then sleep through the night the next night. So really setting a time and a schedule for yourself is going to be really important. The other important thing about that clock is waking up at the same time. So many people close to me, I'm sure people close to you, maybe even yourself, have been laid off or furloughed. What that does is it opens an opportunity to stay in bed all day. And many of us try to take advantage of that. And it's a really big mistake. Okay, waking up, getting out of bed, and starting your day off right, whether or not you have a job to go to or something specific to perform, is just so important. Okay, so we've decided our time, and how are we going to prepare for bed? So first of all, we really want to limit the amount of alcohol or caffeine. I want you to think about the last time you drank caffeine if you're having a difficult time falling asleep at night. Really cutting out all sodas and processed foods. Also, that dessert you had late at night often has lots of added sugars and processed flours that probably are stimulating you quite a bit. You know, we always endorse exercising. Exercise is incredibly important for your health, but I really recommend trying to stop exercising at about 6 o'clock, simply because our heart rate is going to be up, our serotonin and our dopamine are going to be racing, and all those good things that happen from exercise may prevent us from falling asleep. I want you to try not to eat food for 3 hours before bedtime, especially if you're somebody who has reflux issues or abdominal issues, stomach issues. Um, I really want you to limit the amount of food that you're eating before you go to bed. Okay. The other thing we want to limit, and this is what's become so hard, is things that are going to make us tense or stressed. So, you know, being up to date on the news is important, but right before bedtime is not the best time to do it. Reading enjoyable page turners, that's great, but it's not something I want you reading right before bedtime. Try to read something neutral or boring. Really try to limit the amount of screen time. You know, TVs and computers, they're lights and our brains are going to adjust accordingly, thinking that it's light out. So, limiting those screens, limiting those phones, and limiting those TVs, that's really, really going to shift our mind and shift our body into a sleep mode. If you're somebody who finds yourself getting up to go to the bathroom in the middle of the night, try to limit your fluid intake about 3 hours before you go to sleep. That's probably going to prevent you from waking up in the middle of the night and having to go to the bathroom. So we've prepared for bed and we're walking into our bedroom. And what should our bedroom be? A bedroom should really be for sleep, which, if you can tell, if you're a careful observer, I'm not right now. And, you know, we always have to acknowledge things and our limitations and forgive ourselves for those things. But, you know, the bedroom should be for sleep. For me, unfortunately, it's become my office. And, you know, we do our best. We always do our best. But have you ever walked into a spa or a massage therapist or just a nice, beautiful piece of nature and just completely released? You feel completely calm. That's how your bedroom should feel. You know, it shouldn't be cluttered. It shouldn't be busy. It shouldn't, you know, have animal prints everywhere and lots of flashing lights. And frankly, it shouldn't even have a TV in it because we really, really want to commit our bedroom space for what it's meant for, which is sleeping. So the light should be low. The furniture should be fairly minimalist. And if you can, I want you to invest in a high quality mattress, high quality pillows, and good sheets. Okay. So you've got this big, beautiful bedroom. You've gone to bed on time and you get into bed and you still can't fall asleep. And that happens to all of us. So the first thing I want you to do is consider reading like a nice neutral book, not a page turner, not your favorite detective novel, maybe a piece of nonfiction that's interesting, but it's not going to keep you awake. I want you to read it under a lower light to really help with falling asleep. And if you're still struggling, I don't want you to stay in bed for more than 20 to 30 minutes. I want you to step outside of your bedroom, go sit on the couch someplace and continue to read. Really wait until you nod off a little bit and then come back into the bedroom. Okay? Again, our bedroom should be for sleep, not for struggling, not for these recurrent thoughts. You know, another nice technique that we can talk about a future video is thinking about meditation or breathing exercises before you go to sleep. We have some really nice resources on the Smilo website that can direct you towards that and give you some ideas. Now, I would never recommend supplements without talking to your physician first, but two supplements that I often prescribe are either melatonin or magnesium. And if you're still struggling with sleep, that's something that I would recommend talking to your doctor about. Look, we're in a tough time and sleep is tough to get. And it's something we all struggle with. And just acknowledging that and forgiving ourselves for that, and then putting ourselves in the best possible position to succeed, I think you're going to get a good night's rest. And I think you're going to get a good night's sleep. And I think if you prioritize it, you're going to feel better and you're going to get through this with a lot more success. I wish you all well and stay safe.